Welcome to the Fix Harare podcast, brought to you by Harare News. My name is Tawanda Mudzonga. I'm the editor of Harare News. In our third episode, we're once again going to talk about coronavirus and the vaccine. The pandemic has affected every aspect of the lives of Harare residents, and we want to use this podcast to better understand how Harare has been particularly affected by it. As we head into winter season, where respiratory diseases become more common, we've invited Dr. Norman Matara, Secretary General of the Zimbabwe Association of Doctors for Human Rights, ZADHR, to help us put into context how coronavirus has affected the city. Welcome to the Fix Harare podcast, Dr. Matara.
Thank you very much.
Can we start by you telling our listeners a bit about Zimbabwe Association of Doctors for Human Rights and what role it has been playing since the pandemic began?
Okay, Zimbabwe Association of Doctors for Human Rights, it's a membership-based organization that was formed in 2002 with the main aim of advocating for the right to health, which is the right to the highest attainable standards of physical and mental health. And during the COVID-19 pandemic, we've been doing a lot of work here in terms of advocacy. We've been producing what we call monitoring reports, where we've been monitoring the government's response to the COVID-19 pandemic and offering possible solutions and critiquing some of the response. We've also actively participated in donating some materials, especially PPE, for our frontline health workers. We've donated in Matara, we donated in Bulawayo and Kweru. We also donated in Masvingo, and as well, we've also started a program where we are trying to prevent infections in what we call detention centers. These are prisons, old people's home, and children's home. So we are also donating PPE there, and also trying to look at the infection prevention protocols and making sure that they put in measures to prevent outbreaks in those settings. So those are some of the work that we've been doing.
Okay, Dr. Matara. I wanted to also ask you, can you help us contextualize the effect of coronavirus in Harare as in comparison to other places in the world?
Well, yes, COVID-19 in Zimbabwe or in Harare, as you say, we are a bit lucky to not have witnessed a major increase in cases or spike in cases compared to other cities, especially in Europe, in Brazil, and in the USA, somewhere there, even in neighboring South Africa. So we see that our cases, although they seemed to be, although they were high for some time, I think around December and January, mainly because of that's when we started witnessing a new variant of the COVID-19. But at least we did not get as many cases as anticipated. And also at the beginning of the pandemic, I think we were not a bit prepared in terms of responding to this pandemic. When the pandemic came in Harare, there were no size for admission, especially for intensive care facilities. You know, people have been admitted at Wilkins, but they did not have intensive care facilities. But over the period of time, these have been improved. Even Wilkins have been renovated. We have seen Paranatua Isolation Center also being renovated, and now we can now admit people, even those with severe disease.
Okay. So just looking at the statistics, as of yesterday, April 7th, according to the Ministry of Health, there have been 36,984 confirmed cases of coronavirus infection, 34,803 recoveries, and 1,531 deaths. Compared to other cities in the world, these numbers seem low, and most people seem to recover. Can you help us to understand why now, especially since lockdown has been lifted, why is it important that people get the coronavirus vaccine?
All right, yeah. So from the start of the COVID-19 and when we were learning about the disease, we actually figured out that the majority of people actually recover without any treatment. So you see that almost 80 to 90%, 85 to 95 to 90% of people actually recover on their own without any treatment. It's the about 10 to 15% of people who then get moderate to severe disease and need hospitalization, and about 2.5 to 5% will need intensive care units admission. So those numbers from the Ministry of Health, they are in line with what have been witnessed worldwide, and what we know about COVID-19 in terms of recoveries. It's not something that we had not anticipated. But we should know that with the infectivity of the virus, even that 10% who are going to get severe disease, or the 2% who are going to die from the disease, if the number of people who gets infected continue to rise, that 2% will become a big figure. What I'm saying is that if we were to have 100,000 people getting infected with COVID-19, and 2% of them are going to die, that's 2,000 people who are going to die. So that will now become a very big figure. So 2% might seem like a small figure, but if the number of people who are getting infected continue to rise, we will then see an increase in the number of deaths, and that is what we really need to prevent against. So these vaccines, as they come, they are going to prevent people from getting severe disease and from getting admitted in hospital. So they are very important. One, because they prevent people from dying. Two, they also prevent our hospitals from being overwhelmed, such that people may die from other diseases as well. If you see in other countries where COVID-19 cases are rising and more people are getting admitted, they may not be sufficient resources to treat other health ailments, like people who get involved in RTAs, people with diabetes, people with hypertension and things like that. So the vaccines will also help our hospitals from getting overwhelmed. They also help the country in terms of getting back to normal. If people are vaccinated, it means that people can now go outside and do their normal play activities. People can go into restaurants, pubs, people can go back to work, and the economy can actually open. So we really need people to get vaccinated, because this is the only way for us to reduce deaths and also for the country to go back to normal.
Okay, no, I agree on that there. We would like life to go back to normal for sure.
Yeah.
What do you think of the City of Harare's response to Corona? Do we have enough testing sites? Is testing affordable? Are there enough vaccination centers?
Well, I think for the response that have happened, I think it was more of a learning curve for the City of Harare. I think, as I said in the beginning, that when COVID came, I think we were not prepared. There were a lot of issues that came up. The issue of ambulance, even the city did not even have adequate ambulance to transport people. The city did not have adequate sites to even admit people. Wilkins was not prepared. But these were some of the things that got rectified along the way. We saw Wilkins being renovated, and now can actually cater for people with moderate to severe disease. We also saw a bit of testing sites increased, although most of the testing was now being done in private sectors, and most people could not afford testing. Testing is one thing that we have been saying. We did not actually have enough testing sites to treat people, to test people for free. So that alone was, I think, a weaker side of the response. But for people who have symptoms and were symptomatic of COVID-19, I'm sure most people were able to get tested. But for us to do mass testing to include even those without symptoms, I think we did not have that capacity to do that. And then when it comes to the COVID-19 vaccines, I think in Harare there are about 24 centers that are offering vaccination, and they've tried to cover, I think, in my own opinion, the whole of Harare. Like you see the vaccination centers even in the local suburbs, then Kwaza and Ambare and things like that. So I'm sure, I think they've really tried to put vaccinations across the whole the city. And if you have been seeing comments from people who are going to vaccination centers saying that it's not really taking a lot of time. Now, when the vaccinations began, there were a little bit of queues because the centers were few, but they have since been decentralized to include many other centers. As I said, we now have 24 centers, and I think they are enough. But it is just that the uptake seems to be a bit low at the moment. Of course, the numbers are increasing, but we think that we have the capacity to actually double or even triple the figures that are being vaccinated per day. What is lacking is for the city maybe to continue putting out educational campaigns on the vaccines to dispel the myths and misconceptions associated with the vaccines, so that the program that they have started will have an increased uptake by the population.
Yes, that's true. There's been a lot of misinformation, maybe I can say, floating around on social media, which has affected people's decision.
Yeah, exactly. Even before the vaccines came to Zimbabwe, there have been a lot of false information from social media, and this misinformation actually spread more than the truth concerning the vaccines. So that's why there is a need for an effective communication plan to make sure that any myth that is spread on social media is quickly countered, and the correct information is also available to the people. Also, even in terms of the vaccination centers, there have been a lot of people who have been asking me, where do we get vaccinated? Because they actually do not know where the vaccination centers are situated. So there is a need again for the city to continue publishing. I know they put out a list on social media, but they need to continue posting these things on social media, radios, so that people who may have missed the initial communication at first will have a chance to know where they can get vaccinated.
Okay. So the government has said that it is their goal to vaccinate 60% of the population. Can you help us to understand, what does herd immunity mean?
Okay, so herd immunity, it's a concept in public health where you do not need to vaccinate everyone within a population to control a disease. It's a figure that is put depending on how infective the virus is, or the virus that you are trying to vaccinate against is. So you'll see that for other disease, herd immunity can be up to 95% if that virus is very, very infective. It means you have to vaccinate about 95%. So for COVID, the epidemiologists have studied it to say that if we vaccinate about 60 to 65% of people, we will be able to control the disease spread. We will not have spread of infection. So if you work with 60 to 65% with our population, it comes to about 10 million people at the moment. So that is where it is coming from.
Okay. And my final question to you, Dr. Matara, is, once you get the vaccine, how long will it last? Will it be like the flu shot in other countries where you get a vaccine every year?
Okay, so at the moment, we do not have any information on how long the immunity from COVID-19 vaccines will last, because this is something that can only be seen as people continue to live, and you have your antibody titers measured to see if they are going down or if they continue high. So with vaccines, you will see that there are different vaccines. Other vaccines, you might get vaccinated once and then you have immunity for life. Other vaccines, you may need to get booster shots every 5 years. If you look like the tetanus vaccine, you might need to get vaccinated every 5 years. And the flu shot, as you said, you need to get vaccinated every year. So for COVID-19 at the moment, we do not have information to know how long the immunity will last. This is something that we will see with time. So we might need to get booster shots every year if that is the case, or we might actually be protected for life. This is a question where the answer scientists do not have at the moment, and we'll only know in the future how long the immunity will last.
Okay, thank you so much, Dr. Matara. Thank you for joining us today.
Oh, you're welcome. Have a good day.
Yesterday, I received the Sinovac vaccine from Wilkins Hospital. The queues were short and the staff were friendly and efficient. Here are what some of the people who were also vaccinated that day had to say. Okay, can I ask what made you decide to get the vaccine?
After doing my research, going on webinars, you need to move ahead. I mean, COVID is a killer, so
Yes.
You need to protect yourself, and if vaccine is our hope, let's go for it.
Okay, you're not
Yes.
worried about any side effects or anything like that?
Nope, I'm not.
Is anyone else in your family?
Everybody. I'm one of the last ones to have it done. My mom's had it. My daughter came and had it, so, and they haven't had any side effects. I guess they said the first day maybe the vaccine was a bit sore on the arm, but otherwise no side effects. It was so swift. I felt nothing. She says, "Oh, ndabai." I've done it. Next one. It's really fast. I'm actually impressed by the service. It's been really good. I think I've been here for like tops 20 minutes.
The vaccine.
Well, I'm not too sure, but I hear that it helps. So that's why I want to take it. Yes, I've got relatives who have died because of this disease, and I don't want to go into the same situation.
So there's a lot of misinformation floating around about this vaccine, but you are feeling confident.
Yes, the whole world can be wrong. Yes, a few people who say they are not sure of it and they don't have any scientific proof. So if everybody is taking it and the whole world is taking it, why should I not take it as well? So I feel I will be safe.
Okay.
Yes.
And you said your wife is taking it now?
Yes, my wife is inside.
And anyone else in your family has taken it?
Not yet. It's only me and my wife.
And then everyone else will follow?
Then everyone else will follow.
Okay. All right.
Follow, yes.
And you don't have any problems with this vaccine being a Chinese vaccine?
I don't think so. China is a very strong country, very rich. 1,400,000,000. That's not a joke. Yeah, it's a strong country. So I've got the belief that the vaccine is okay.
We've come to the end of this episode of the Fix Harare podcast, brought to you by Harare News. Please look out for the next episode, which will be available on Spotify, Google Podcasts, and Anchor, as well as on Facebook and Twitter on our handle @Harare News. Until next week, goodbye from us here at the Fix Harare podcast.